Hello everyone, now let us discuss about 2023 ICD 10CM coding guidelines for Chapter 21, Part 3. Chapter 21 mainly deals with factors influencing health status and contact with health services. And the chapter specific guidelines, they provide additional information about the Z codes for specified encounters. And in the current session, we will be discussing about the observation Z codes. Now coming to observation, there are three observation Z code categories. They are for the use in very limited circumstances when a person is being observed for a suspected condition that is ruled out. The condition must not be present. It must be ruled out. A suspected condition must be ruled out. Then only you can code observation codes. The observation codes are not for use if any injury or illness or any sign or symptoms related to the suspected conditions are present. In such cases, the diagnosis or symptom code is used with the corresponding external cause code. Whenever a sign, symptom or any injury or illness is present, that specified code is given instead of observation code along with the external cause code. The observations are primarily to be used as a principal or first listed diagnosis. And it can be used as SDX also in certain cases. An observation code may be assigned as a secondary diagnosis when the patient is being observed for a condition that is ruled out and is unrelated to the principal or first listed diagnosis. Also, when a principal diagnosis is required to be coded from the category Z38. Z38 can be used only as first listed diagnosis that deals with the place of birth and type of delivery. So when the principal diagnosis is required to be coded from the category Z38, that is live born infants according to place of birth and type of delivery, then a code from the category Z05. Whenever Z38 is coded, that is PDX, followed by code from the category Z05. Encounter for observation and evaluation of newborn for the suspected diseases and conditions ruled out is sequenced after the Z38 code. Now here you can see the various set of Z38 series. Z38.00 deals with single live infant delivered vaginally. Single live born infant delivered vaginally. Z38.01 deals with single live born infant delivered by C-section. And Z38.1 indicates single live born infant born outside the hospital. The next is Z38.2. It deals with single live born infant unspecified as to place of birth or single live born infant annoyance. The next is Z38.30. Twin live born infants delivered vaginally. Next is Z38.31. Twin live born infant delivered by C-section. Next is Z38.4. Twin live born infant born outside hospital. The next is Z38.5. Twin live born infant unspecified as to place of birth. The next is Z38.61. Triplet live born infant delivered vaginally. Next is Z38.62. Triplet live born infant delivered by C-section. Next, Z38.63. Quadruplet live born infant delivered vaginally. Z38.64 deals with quadruplet live born infant delivered by cesarean. Next is Z38.65. Quintuplet live born infant delivered vaginally. Next, Z38.66. Quintuplet live born infant delivered by C-section. Next is Z38.68. Other multiple live born infant delivered vaginally. And Z38.69. Other multiple live born infant delivered by C-section. Next is Z38.7. Other multiple live born infant born outside hospital. Finally, Z38.8. Other multiple live born infant unspecified as to place of birth. These are the various codes from the category Z38 and they can be used only as primary or first listed diagnosis. Additional codes may be used in addition to observation code. unrelated to the suspected condition being observed. And the codes from the subcategory Z03.7, encounter for suspected maternal and fetal conditions ruled out, may either be used as first listed or as additional code assignment depending upon the reason for encounter or particular case. There are for use in very limited circumstances on a maternal record when an encounter is for a suspected maternal or fetal condition that is ruled out during that encounter. For example, a maternal or fetal condition may be suspected due to an abnormal test result. They are used very limitedly on a maternal record. These codes should not be used when the condition is confirmed. Observation codes should not be used when the condition is confirmed. You must only use observation codes when the condition is suspected and ruled out. It will be present in the code description itself. These codes should not be used when the condition is confirmed. In those cases, confirmed condition should be coded. In addition, these codes are not for use if an illness or any sign or symptoms related to the suspected condition or problem are present. In such cases, the diagnosis or symptom may be used. Symptom code may be used. Additional codes may be used in addition to code from the subcategory Z03.7, but only if they are unrelated to the suspected condition being evaluated. And the codes from subcategory Z03.7 may not be used for encounters for antenatal screening of mother. This is important. Codes from subcategory Z03.7 may not be used for encounters for antenatal screening of mother. For that, you can refer the previous video or you can see section 1C.21, that is screening. And for encounters for suspected fetal conditions that are inconclusive following testing. For encounters for suspected fetal conditions that are inconclusive following testing and evaluation, assign the appropriate codes from category O35, O36, O40 or O41. Not the observation codes. This thing you can find in the chapter 15 videos. Now coming to observation Z code categories, there are three categories: Z03, Z04 and Z05. Z03 deals with encounter for medical observation for suspected diseases and conditions ruled out. Z04 deals with encounter for examination and observation for other reasons except Z04.9, encounter for examination and observation for unspecified reason. The next is Z05. It deals with encounter for observation and evaluation of newborn. Encounter for observation and evaluation of newborn for suspected disease and conditions ruled out. In the current session, we will discuss each code in all these three categories: Z03, Z04 and Z05. Now coming to Z03 series, which is nothing but encounter for medical observation for suspected diseases and conditions ruled out. The first code is Z03.6, encounter for observation for suspected toxic effect from ingested substance ruled out, or encounter for observation for suspected adverse effect from a drug, or encounter for observation for suspected poisoning. In all these three cases, you need to code Z03.6. Next is Z03.71, encounter for suspected problem with amniotic cavity and membrane ruled out, or encounter for suspected oligohydramnios ruled out, or encounter for suspected polyhydramnios ruled out. In all these three cases, you need to code Z03.71. The next is Z03.72, encounter for suspected placental problem ruled out. The next is Z03.73, encounter for suspected fetal anomaly ruled out. The next is Z03.74, encounter for suspected problem with fetal growth ruled out. The next is Z03.75, encounter for suspected cervical shortening ruled out. The next is Z03.79, encounter for other suspected maternal and fetal conditions ruled out. The next code is Z03.810, encounter for observation for suspected exposure to anthrax ruled out. The next is Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. The next is Z03.821, encounter for observation for suspected ingested foreign body ruled out. The next is Z03.822, encounter for observation for suspected aspirated, that is inhaled foreign body ruled out. Previously it is ingested foreign body, next is inhaled foreign body. The next is Z03.823, encounter for observation for suspected inserted foreign body ruled out, or encounter for observation for suspected inserted foreign body in eye ruled out, or encounter for observation for suspected inserted or injected foreign body in orifice ruled out, or encounter for observation for suspected foreign body inserted foreign body in skin ruled out. In any of these cases, you need to code Z03.823. Only thing is condition must be ruled out. It must be suspected and it must be ruled out. This is a new code that has been added, that is Z03.83. Encounter for observation for suspected conditions related to home physiological monitoring device ruled out, or encounter for observation for apnea alarm without finding ruled out, or encounter for observation for bradycardia alarm without finding, or encounter for observation for malfunction of home cardiorespiratory monitor, or encounter for observation for non-specific finding home physiological monitoring device, or encounter for observation for pulse oximeter alarm without finding. In all these cases, you need to code this new code Z03.83. And finally, Z03.89, it deals with encounter for observation for other suspected diseases and conditions ruled out. Now coming to next category, Z04, that deals with encounter for examination and observation for other reasons. The first code is Z04.1. It deals with encounter for examination and observation following transport accident. The next is Z04.2. Encounter for examination and observation following work accident. The next is Z04.3. It deals with following other accident. The next is Z04.41, encounter for examination and observation following alleged adult rape or suspected adult rape ruled out, or suspected adult sexual abuse ruled out. In all these cases, you need to code Z04.41. The next is Z04.42, encounter for examination and observation following alleged child rape or suspected child rape ruled out, or suspected child sexual abuse ruled out. In all these cases, you need to code Z04.42. The next is Z04.6, encounter for general psychiatric examination requested by authority. The next is Z04.71, encounter for examination and observation following alleged adult physical abuse or suspected adult physical abuse ruled out. The next is Z04.72, encounter for examination and observation following alleged child physical abuse or suspected physical abuse ruled out. The next is Z04.81, encounter for examination and observation of victim following forced sexual exploitation. The next is Z04.82, encounter for examination and observation of victim following forced labor exploitation. The next is Z04.89, encounter for examination and observation for other specified reasons. Next is Z04.9, encounter for examination and observation for unspecified reason. Now coming to next category, that is Z05. Encounter for observation and evaluation of newborn. Encounter for observation and evaluation of newborn for suspected diseases and conditions ruled out. The first code is Z05.0. Observation and evaluation of newborn for suspected cardiac condition ruled out. The next is Z05.1. Observation and evaluation of newborn for suspected infectious condition ruled out. The next is Z05.2. Observation and evaluation of newborn for suspected neurological condition ruled out. The next is Z05.3. Observation and evaluation of newborn for suspected respiratory condition ruled out. The next is Z05.41. Observation and evaluation of newborn for suspected genetic condition ruled out. The next is Z05.42. Observation and evaluation of newborn for suspected metabolic condition ruled out. The next is Z05.43. Observation and evaluation of newborn for suspected immunologic condition ruled out. The next is Z05.5. Observation and evaluation of newborn for suspected gastrointestinal condition ruled out. The next is Z05.6. Observation and evaluation of newborn for suspected genitourinary condition ruled out. The next is Z05.71. Observation and evaluation of newborn for suspected skin and subcutaneous tissue condition ruled out. The next is Z05.72. Observation and evaluation of newborn for suspected musculoskeletal condition ruled out. The next is Z05.73. Observation and evaluation of newborn for suspected connective tissue condition ruled out. The next is Z05.8. Observation and evaluation of newborn for other specified conditions ruled out. And finally, Z05.9. Observation and evaluation of newborn for unspecified suspected condition ruled out. Now let us see some examples. First one is patient fell off his motorcycle when turning too sharply and hit his head on the sidewalk. The patient was wearing a helmet. The examination relieves no outward apparent head injury. He had a motorcycle accident and the examination relieves no outward apparent head injury. But the only injury noted on examination is abrasion of the right upper arm. The patient is admitted overnight for the observation unit to rule out head injury and no head injury was found. Here you can quote many quotes, but for our convenience I am giving only the PDX. Z04.1. Encounter for examination and observation following transport accident. Here observation was done for a suspected head injury and finally head injury is ruled out. So encounter for observation, examination and observation following transport accident. Additionally, you can quote abrasion of the right upper arm because they are unrelated. Abrasion of the right upper arm because it is unrelated to head injury, and additionally you can quote external cause codes. Here I am only discussing the observation code. Z04.1 is the observation code for this particular example. Z04.1 which is nothing but encounter for examination and observation following transport accident. Next example is an adult patient is admitted for observation and further evaluation following an alleged rape. Ruled out. This condition is ruled out. So the appropriate code is Z04.41. Encounter for examination and observation following alleged adult rape or suspected adult rape ruled out. Next example, patient is admitted to observation for syncope and the patient has diabetes mellitus. After testing, no cardiac or other cause was found. Patient is having DM, but the syncope is not related to diabetes mellitus and he is admitted for observation for syncope. So the appropriate code is Z03.89. Encounter for observation for other suspected diseases and condition ruled out. Because no cardiac or other cause was found, the appropriate code is observation code, that is Z03.89. Encounter for observation for other suspected and conditions ruled out. Suspected diseases and conditions ruled out. Now coming to final example, a 38-week-old pregnant woman delivers the baby vaginally, and the newborn was suspected for fetal alcohol syndrome. The newborn is suspected for fetal alcohol syndrome due to alcohol exposure during the pregnancy. And the newborn did not show any symptoms or defects, and the condition was ruled out. Here, the PDX would be Z38.00, single live born infant delivered vaginally, followed by Z05.2, because the fetal alcohol syndrome was suspected and ruled out. Observation and evaluation of newborn for suspected neurologic condition ruled out. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.